Good to go.
Okay, thank you. Okay. Hi, my name's DeeAnna. I'm going to be your nurse today. Can I get your name and date of birth, please?
Yeah, RC Village 62903.
Perfect. And do you know what day it is?
Yeah, Tuesday.
Okay, and where, do you know where you are?
Hospital.
Okay, perfect. And what brings you in today?
Assessment for today.
Okay, fantastic. My patient is ANO times 4. Upon conversation with her, I'm noticing that her skin color and lip color is appropriate. Her speech is also clear and appropriate, affect as well. The face is symmetrical. There's no signs of drooping, which would indicate a sign of a stroke. There's no signs of cyanosis or jaundice or anything like that. I'm going to go ahead and check the conjunctiva. So if you could just go ahead and look up for me. Okay, the conjunctiva is pink and appropriate for the patient as well. Can you open your mouth and say "ah," please? Mouth is moist. And then I'm going to go ahead and check your pupillary reflexes, okay? Can you just look straight ahead?
What? Dude, you can turn back.
Okay, thank you. And then if you could just follow my pen with just your eyes, please.
You just can't do that. You can laugh a little bit, but you gotta come back.
Okay, so point is going to check the patient's head. Make sure that they don't have any signs of like infestation.
Okay, thank you. And then if you could go ahead and look at that wall for me and then back at the pen. Okay, perfect. Pupils are equal, round, reactive to light, and accommodating. Are you having any difficulty swallowing?
No.
And do you use any oxygen at home?
No.
Okay, so you're on room air as well. Perfect. I'm going to go ahead and move on to the chest assessment. I'm going to check for skin turgor. I'm going to pinch underneath the clavicles. There's no signs of tenting, so my patient is not dehydrated. Are you experiencing any shortness of breath at rest? How about on exertion? Any dizziness or chest pain? Okay, now I'm going to go ahead and listen to the heart. Now, usually you'd want to do this on the skin, but for the sake of the video, I'm going to do it over the clothes. Okay, the heartbeat is strong and regular, S1 and S2 present, no other sounds or murmurs or signs of S3 and S4. Now I did check the apical pulse. Usually you want to do that for a full minute, but again, for the sake of the video, we're going to say that my patient is within normal limits, which is 60 to 100 beats per minute. And upon listening to the heart, I noticed that my patient had equal chest expansion. The respirations were regular, they weren't deep, they weren't shallow, and there was no use of accessory muscles. So now I'm going to go ahead and move on to the lung assessment for my patient. Now, if you could just take a deep breath in through your mouth and out through your mouth every time I place the stethoscope for me. And again, on skin, but we're doing it over.
Check his mouth. It appears to be moist and pink. Speech is clear, appropriate, and he doesn't appear to be on any oxygen. So I'm going to move on. Do you have any difficulties with swallowing? No. No? I'm going to go ahead and put my hands on your shoulder. I just want you to slug your shoulders against my hands real quick. Let's see. Good. Okay. And so a little bit of range of motion.
Okay, interior lung sounds are clear. There's no adventitious sounds like wheezes, crackle, or bronchi. I'm going to go ahead and check the posterior lung sounds now. You can go ahead and lean up for me. Thank you so much. And then again, the same thing, in through your mouth and out through your mouth upon movement.
Now we need to do it with your arms. All right, can you raise your arms up to the skies?
All of them purpose, yeah.
Back around.
Yeah.
And back down into your lap. Any pain associated with that? No. Okay. And now can you puff out your cheeks? Can you open your mouth, say and can you give it a breath?
Okay, thank you. Posterior lung sounds are clear as well. No signs of adventitious sounds like wheezes, crackles, and rhonchi. I'm going to go ahead and move on to the abdominal assessment now. Okay, when was your last bowel movement?
This morning.
And do you have any difficulty voiding or trouble with the bowel movements?
No.
Okay. Do you pass gas regularly?
Yeah.
Any nausea or vomiting? And any incontinence?
No.
Okay. And then what color is your urine the last time you went to the
Like
restroom?
yellow.
Okay, perfect. I'm gonna go ahead and lean the bed back so I can do more of an inspection. While I'm doing this, I'm also gonna inspect for any tubes, drains, or Foley catheters on my patient. They don't have any. If they were, I would note the date of the Foley catheter being placed, and then I would also check the location around the tubes or drains and just make sure that everything was good and there was no kinks. I'm gonna inspect my patient as well and see that the abdomen is flat, it's not round or distended. And so now I'm going to go ahead and auscultate your abdomen. I'm going to go ahead and listen to the 4 quadrants, starting at the right lower quadrant and moving around clockwise. May I lift your sweater? Okay, thank you.
Now I'm just going to take out my hearing aid, but I'm going to be taking a listen to your lungs in the back, and also to your heart. But first, I'm going to check your chest expansion real quick, okay?
Okay, there are sounds present in all 4 quadrants. They're normal active. Now I'm going to go ahead and palpate the abdomen and just let me know if you feel any tenderness upon palpation, okay?
Back in front of you, and then back down to your sides. Full range of motion.
So chest expansion
Now I'm just gonna be checking some stuff.
is symmetrical.
Can you raise
Any
your
tenderness?
And so you
Okay,
have
the
any
abdomen
trouble,
is soft and non-tender.
No.
moist?
Chest pain.
Okay, so now I'm going to go ahead and move on to the upper extremities. Just let me know when this is a comfortable position for you.
Okay, I'm fine.
Okay, wonderful. Now, have you noticed any numbness or tingling in your arms or fingertips? Okay. I'm going to go ahead and check your capillary refills. If I could see your fingertips for me. Okay, cap refill is brisk, which means that it refills less than 3 seconds. And can you do this for me, please? Okay, no signs of clubbing. I'm going to check your radial pulses. Okay, they're strong, regular, +2 bilaterally. And then I would also go ahead and I'm noting that my patient doesn't have any IVs or saline locks. If they were to have any IVs or anything like that, I would check for any pain, tenderness, erythema, swelling, and I would also note the rate and solution. And as noted, there was no clubbing and brisk, all that good stuff. So now I'm gonna go ahead, oh, and can I squeeze my fingers, please? Push. Towards me. Pull towards you. Okay. Strength is +5 in both extremities as well. Now I'm going to go ahead and move on to the lower extremities. So have you had any numbness or tingling in the lower extremities? Okay. Can you push up on my hand? And then pull down on my hand? Same thing with this side? Okay. Perfect. So +5 on both legs as well for strength. Now I'm also noting for any edema, and it doesn't look like I see any regular edema or pitting edema or anything like that in the legs or the ankles, or the feet as well. Can I? Okay. I'm gonna go ahead and take off the patient's socks so that I can look for capillary refills as well. So I'm noting that cap refill is brisk, less than 3 seconds. And then I'm gonna check the pedal pulses.
Put it with my stethoscope so you don't forget it's over there.
Okay, pedal pulses are strong, regular, bilaterally, +2 bilaterally as well. Do you want me to put these on for you?
It's fine.
Okay.
You guys do.
And then if you could pull towards you, and then push towards me. Okay, excellent. So those are also +5 as well. So now I'm going to move on to the skin. So throughout my assessment, I noticed that my patient's skin is warm, dry, and intact.
Okay, let me just ask.
I've noticed that my patient's skin is warm, dry, and intact. And then I'm also going to check for all bony prominences, which would be behind the head, behind the shoulders, the scapulas, the elbows, the sacrum, under the legs, and then the heels as well. So my patient, I don't notice any wounds or incisions. But if I were to notice any wounds or incisions, I would note the location, the length, width, and depth. I would also note the stage of healing, if there's any drains or drainage, in that wound. I would also note like the surrounding wound bed if I see any slough, exudate, and what that looks like, any granulation or anything like that. And so now I'm going to go ahead and move on to musculoskeletal. So do you use any assistive devices at home? Any canes, walkers, or need assistance using the bed to get around? Okay. If you could take both arms and just lift them up and around for me, please. And if you could lift this leg up and out, and same with the other leg. Okay, perfect full range of motion in the extremities. Do you have any generalized weakness? Okay. Now would you mind standing up and just walking to the curtain and back, please? Okay, the gait is normal. Again, I also don't notice any generalized weakness in my patient, and I don't notice any joint deformities or contractures or anything like that. And then lastly, are you experiencing any pain? Okay, if my patient has no pain, but if my patient were to have pain, I would ask on a scale of 1 to 10 what that pain was, the location of the pain. I would also ask like how long it's been happening. Is it constant, intermittent? What makes it worse? What makes it better? And if there's any like signs and symptoms additional to the pain as well. And then lastly, I'm gonna go ahead and just ask some questions that I have to ask every patient. Are you experiencing any anxiety? No. Okay. Do you have any cultural, spiritual beliefs that we should know about? No. Okay. Do you have the support at home?
Yeah.
Excellent. And lastly, are there any concerns or questions that you have for me?
No.
Okay, thank you. Now, I believe this concludes our head-to-toe assessment.